Title of this video is Medicine is not a science. Medicine is an art. I think you really have to look at medicine and see that kind of the majority of it, probably like 95% of it, is not really evidence-based. 95% of it is really just built up over the observations and successes of previous generations of physicians. That's the reality of medical care. Definitely there are some huge advancements from evidence-based medicine, and there's some landmark papers that have been published, and they've definitely affected the management of some serious diseases. But I think overall, definitely, a lot of what we do, definitely as radiologists, is not evidence-based. It's really just the best idea we have of how to take care of patients in medicine, and I'll elaborate. For example, scanning patients in the ER with a CT abdomen pelvis for abdominal pain. As far as I know, there is absolutely no randomized controlled trial that proves that this is a effective and beneficial thing. Yet, we all know that this is widely utilized, and I definitely think there's a huge benefit. So a patient comes in with abdominal pain, we don't know what it is. Yeah, we can do some physical exam maneuvers that have been established over the years, but the sensitivity, specificity of that is extremely questionable. We run them through a CT scanner. It takes a few seconds. It's pretty safe. There is some radiation risk. There is some contrast risk, but overall it's pretty safe. And then a radiologist with training can look at basically millimeter thin slices of your abdomen and pelvis and diagnose you pretty well with a number of acute conditions. They can exclude acute conditions. They can screen for things in the solid organs. And we could put together a pretty nice piece of information that gives you a pretty good idea of if there's something serious going on in the abdomen, or is the abdomen benign, and probably can we safely discharge that patient. I don't think we need a randomized controlled trial to prove this. And then there's issues with randomized controlled trials. First of all, they're expensive. Who's going to sponsor them? Typically, the entity that's going to sponsor a randomized controlled trial is going to be the entity that stands to benefit most from the randomized controlled trial. I think medicine is it's a practice. At the end of the day, it is a practice of medicine. It's basically applying principles that you learn slowly over time, applying them to the patients, observing the results, tweaking your methods. I think really going by the general principles of medicine, which is, safety first do no harm, try to do benefit. That is how these things evolve. I would say that I do not really, I hate to say, I don't think very highly of evidence-based medicine in the sense that I don't know every time that I read a randomized controlled trial that it's given me accurate information. I trust my gut a lot more. I trust the gut of other well-trained physicians that have been responsible for training me, and that is kind of how I make my decisions. That's how I'm going to continue to make my decisions going forward. That's all I got. Struggle MD.